to this edition of Deacon Speakin. And I am your deacon, Deacon Tim Unger, and we have two parishioners of risen Christ, Doctors Elaine and Michael Schwartz. Welcome.
Thank you. Welcome. Thank you for having us.
I wanted to begin by just letting the people know, how long have you been at Risen Christ?
Since about 2007, I believe, when we moved back to Denver in 2006 and in the summer of that year.
2007. And you've been married how long?
Coming up on 26 years this July.
26 years. Congratulations.
Thank you.
July 30th.
You know, in the Deacon Speakin I did with Father Eric, I did a thing to say, I know 15 years, because he had 15 years as a priest. I said 15 years as a married couple is crystal. I have no idea what 26 years is.
Diamonds, no matter what,
I love it. So, and you have 4 beautiful children.
Yes.
We do.
Who have just, in theory, graduated from high school, the boys, and then Talia, our daughter, is in college. She's a rising junior in college.
So, as intensive care unit doctors, I am assuming you have seen quite a bit these last several weeks.
I admitted probably the first patient at Rose Medical Center, and her presentation was very interesting in that she was confused. She didn't really have a lot of lung symptoms, but the fact that she was confused, and the reason why she was confused is that her oxygen level was so low. And so that was actually the end of February, right?
Yes,
the end of February.
Yes. Uh-huh.
And her travel at that time was from New York. And so they really weren't testing that many people because that wasn't sort of the hot spot. But then as people started coming in who traveled to different areas, it's like, well, the symptoms were becoming the same. And just because you weren't in Seattle or Los Angeles or traveled to other countries, the suspicion when we started seeing this, the symptoms were similar, but also different among each other, depending on their age and their risk factors. But as the pandemic continued, we started seeing more and more people presenting with the symptoms that they talked about, the cough, the shortness of breath, the fever.
But really, to Elaine's credit, and at that time, interestingly, Tim, that and for the viewers, the time interval between sending the test and its availability was a number of days and even close to a week.
Mm-hmm.
But Elaine got the right things going for those patients.
Talk to me a little bit about, you're both ICU doctors, and you had to make a decision of, are you both going to go into the fray, so to speak? We talked about your children, your family. What was the decision that you made as a family to how you were going to deal with that?
Well, it was a tough decision in the fact that I'm the medical director of the ICU and
the boss
with one of the nurses. We had to make a decision in the fact that we knew we were going to be busy. We both work at the same facility, and it was tough because not only do we take that oath of taking care of patients and wanting to be there, we had to make a decision about if we both got sick, what would happen to our family. And so we had done this early on in our marriage when SARS came around the first time. Michael had decided that he would be the one in the hospital and I would be the one taking care of the children. And we just kept that. And the decision we made as a family, we did talk to the kids. They understood it was hard because it's kind of like, well, what if dad gets sick? What are we going to do type of thing? And it was hard, but I think they were supportive of the decision that we made, don't you think?
I do.
It is hard. And I did spend a lot of time with certain families, not all, when they wanted to talk about that. They wanted to talk about, what could they do? I can't go to church, or I can't get to my family. And we would just talk about things, and I would share my faith and they would share theirs. And I think that was really good for me. The other thing is we did allow a few patients on a case-by-case basis with permission from administration to get a family member in there. Not all, but we did make some exceptions. to these patients.
Particularly if they were dying,
Yeah,
and
mainly
that,
it was dying, the
yeah,
dying patients.
Yeah, exactly.
But we had a number of families that we were able to do that, but we couldn't do it to everybody.
For me, it's been an opportunity to go back to kind of this older vision of medicine where, like I mentioned before with Elaine, history, physical exam, just talking with patients and trying to use that. And that's a beautiful thing. I mean, despite the scariness and loss and disruption that this pandemic has caused across the world, it's been an opportunity, I think, to kind of reconnect and get back to some of the fundamentals of physicianship. But as a family, Tim, it is an interesting time. I mean, this is a test. This is a test in so many ways, but as a challenge and as a test, it's also an opportunity to, I think, to really to think about one's relationship with God and what you're doing and what you want to do with and for other people, and to try to live more like the Gospels, you know what I mean, and thinking about Jesus and sort of what he would be guiding us to do at this time. And that's been a great source of strength for me as a doctor, as a dad, just as a man, as a citizen, of this country. I mean, if that makes sense.
But also it can be, it's, to me, like Michael talked about, it's a test because we can't go to Mass. And when there was Mass, you could come up with every excuse not to go to Mass, correct? And so this, this actually makes it, it's a test. Once we can come back to Mass, how many of us will be able to, will do that? And we talk about that as a family, and they just, I think they're struggling with that. They are questioning, again, the why. How can this happen? So that's why we need people like you, Tim, to show us the way. Really.
Well, that's why I'm obedient to my pastor. That's what Father Scott does.
But I do feel that way, Tim, and I feel that way because some of the things that I've tried to do as a doctor all these years have really, I think, borne out with coronavirus. And so from a disease standpoint, the ARDS, the acute respiratory distress syndrome, what I've been doing, and some of the ways that I try to be a doctor with individual patients, and the things that I know that Elaine does as well, I do think that this was part of God's plan for me, and professionally, and yet it has been, it has been scary, but I feel like it's been a good cause. This has been sort of fighting the good fight, but I do feel the Lord, guiding us and helping us. And so, so I do feel like I've sort of trained my whole life for this, Tim. This is where my faith journey and professional journey, I think, have kind of intersected. And
I think that falls well into the definition of doing what God has asked you to do. So, I mean, that's probably why you get the joy from it. So God bless you.
He does, and you can see it. So,
I just want to end by saying that, it's always been attributed to St. Francis. We don't know if he actually said this, but he was known for the saying to say, preach the gospel always, and if necessary, use words. I think that's what you're doing. And I really believe from the bottom of my heart that God bless you for answering that call. That God, you mentioned, even if it's just in your professional life, what he's asked for you to do, and for being there for these people that are suffering. I know there's a lot of fear, anxiety, and it's tugging at our human relationships. And you've brought a little bit of that back to the families and the people. And I am thankful for that. I'm thankful for what you do. I'm thankful for your faith, for your beautiful family, and the fact that you have gifted our parish by just being there.
that's very kind.
That's
Thank you.
Well, thanks for letting us go on Deacon Speakin for 10 minutes.
It is an honor to have you on Deacon Speakin.
Thank
You
you.
are now the official physicians of Deacon Speakin. So
Okay, great.
Okay.
There you go. Thanks.
Aye, aye.